Hey, good afternoon, good evening, rather. My name is Andrew Williams, and this is such an exhilarating moment for me. To be able to say I am about to complete my final assessment for my capstone project for nursing and become a bachelorette nurse, that's exciting. My journey has come to a transition point with the promise of a BSN within my grasp and the advent of a new journey that offers a master's degree just above my horizon. My capstone project focus explored hypertension and its impact on society and the development of an evidence-based intervention. For me, that was a brochure. The brochure was designed and proposed to my course instructor for approval and then presented to my selected patient, Mr. X. Mr. X, of course, is not his real name, just an alias to protect his privacy. Okay, so the contribution of the intervention uh, to patient satisfaction and quality of care. The brochure will contribute to lifestyle change and support that will help Mr. X manage his hypertension and other comorbidities. It will lead to a better quality of life and better satisfaction for Mr. X himself. Mr. X disclosed that the brochure covered several points that he felt would make self management easier. He expressed gratitude that an analysis of the interview with me was instrumental in designing and developing this brochure. I asked him how he would feel if the brochure was published and distributed in barbershops around the city. It brought a huge grin to his face and a sense of satisfaction to hear he was a part of such an endeavor. Mr. Hex was very happy to learn that he would access telehealth. He would not have to interrupt his busy work schedule to go for a face-to-face appointment with his doctor. He was excited that the video visit would help him to save time and money and ensure his primary care needs are met. Mr. X did something unexpected. He wanted to know if he could refer all his friends. Now, that is a milestone, knowing that black men, in particularly, are the least likely to seek healthcare and the most prevalent amongst diagnosed hypertensive. That is huge. The brochure is a good introductory point for people recently diagnosed with hypertension and maybe not sure what's available. The brochure is filled with information about resources. It tells what hypertension is, what is in terms of your blood pressure, whether you're a stage 1, stage 2, whether you're in crisis. It tells you what are the complications of hypertension. It tells you, like, it's possible to have a stroke, it's possible to have a heart attack. And the big one most men don't want to hear about, impotence. You say that and everybody stand at attention. Okay? It then gives you some community resources, things that they can actually get involved with. Example, in New York City, the Green Cart, or the healthy food shops, or the barbershop initiative. These are all programs in New York City that are designed to help reduce the prevalence of hypertension and help people to manage their hypertension. Okay? Now, the literature used for my project are evidence based. The evidence based sources were utilized for the creation of the brochure. The pieces of literature used were peer reviewed and of the highest quality, such as systemic reviews, quantitative analysis, and government organization websites, which usually have a history of ensuring that the contents are scientifically proven. Example, the World Health Organization, the CDC, and then you have like Healthy People 2030, Million Art Initiative. These are all websites that are evidence-based, scientifically proven websites material you're going to get from here, and which you can also introduce your patients to access these websites to get for their own personal needs. The goals and objective, as I said, came from Healthy People 2030, were evaluated, adapted, and then modified to implement the final brochure product. Programs recommended in the brochure are also evidence-based. They ensure that patients' participation and facilitate self-management of their health condition. Right? So you can have your patient go to healthypeople2030.com and they'll find a buffet of options and idea that they can use in terms of their health management. Technology, the enhancement of technology and how it impacts outcome and communication. Now this one is extremely important, especially to patients like Mr. X. Technology has become ingrained in every fabric of healthcare. A doctor can stay halfway around the world and still perform a primary care visit using technologies such as telehealth, telemedicine, or self-measure blood pressure monitoring type of intervention, right? So during COVID-19 pandemic, technology that supported telehealth and internet security was not only for COVID-19, but also created a platform for other technologies to improve patient safety and satisfaction, such as the blockchain. It improved security of electronic medical records. In New York City, they implemented a chronic disease management program. During the COVID-19, they used telehealth to reach their patients because no one could go to the clinics. The city was on lockdown, so they used telehealth and telemedicine in terms of video calls to reach out to those patients and get them to still manage their blood pressure during COVID-19. So the self-measure blood pressure monitoring concept from Million Heart Initiative was utilized for that program. Now, health policies. Now, there are multiple health policies that impacts healthcare and the way care is given. In particularly in New York State, the nursing board standards were recognized and upheld throughout the development of this Capstone project. The patient teaching, one of the highest priority in nursing practice, as per New York State Nursing Association .N.D, and it's highlight of an essential aspect of nursing for the patient success. HIPAA and the security rule and privacy laws were maintained to keep the patient electronic medical records and identity confidential. The state government endorsed also as a third area where the state government endorsed telehealth programs for expansion and extension, where people who in the past could not receive telehealth unless they were in rural areas, they eliminate that. Now, as long as you can get to telehealth, whether you're in an urban area or a rural area, you will still have access to telehealth. So if you can't make it to your doctor, you can still get telehealth because this is the new expansion in the law. It's said by Kit et al. In 2019. More people can now access telehealth as a result of that change in governmental policy. There's also the New York State BSN in 10 program, where nurses are encouraged to get their BSN based on the concept that Higher education would provide higher quality of care and will get nurses involved in such things as policy making in areas where they're not normally seen as prevalent. Okay, so that's another one. And then we move on to the capstone outcome. Now, the outcome for the project is definitely not what I imagined it would be. The project took on a life of its own and developed and redeveloped to a new, based on new knowledge. As new knowledge was acquired throughout the process, the project kind of meandered itself into a total different product than I expected it to be. The brochure was able to capture inspiration from multiple aspects of healthcare, including communication, collaboration, patient centered engagement, and of course, within the guidelines of policies and the nursing standards and ethics principles, the code of ethics. So the final product of my capstone project, I am proud of it because it's something that I think can be published and provide service to people who actually need a start from a new diagnosis perspective. Okay. Now, my reflection on my journey. The last 4 months in pursuit of my BSN had taken me on a cognitive roller coaster. From moments of high after getting strong grades to moments of low when grades were not so like it, I had hoped to complete the BSN within a specific time. I kind of went beyond that time. However, I am here now and I'm so proud to be here. It was a lot of work, but I am happy. I've been a nurse 26 years. I have been a nurse 26 years. I can't believe it's so long. And during that time, I've never been inspired to go and get the BSN. But COVID-19, apart from experiencing the things that I experienced, I saw another side of nursing that kind of intrigued me and kind of motivated me to come back to school. And I always knew that I was a strong student. So even though I've not been back in the classroom since 1996, I'm aging myself here. I felt that, okay, as soon as I learned what are the basic things, I'll be back in the saddle riding just like you never forget a skill. So my journey has been inspirational, why I decided that I would continue on, see if I can get my master's, even my doctorate. And who knows? Life happens, and the future for nursing looks bright. At least for me, it does. So I want to say thank you to all my professors. Thank you, Professor Michelle Drisler, for being my final instructor in the BSN program. Have a great evening.